It's been a real pleasure to be at the celebration for the Clinical Board for Specialist Services. As judges, myself, Alice Casey, Margaret McLaughlin have really enjoyed going around all of the posters. Took us longer than we thought, but that was because of the quality and because of the real commitment in terms of talking to staff about providing better patient care, about providing a better opportunity for the staff to provide that care, and also looking at the resource implications of what we do on a day-to-day basis. The overall winner was a team from haematology that are actually looking to stop patients having to make long journeys to come for what might be a very simple outpatient appointment. By use of telephone, they're able to assess the clinical well-being of those patients, and they're able to decide whether those patients need to travel all of that way to get the care. If they need to, then they can organise that. But it's a real boon to patients, I think, knowing that somebody is close by, but not having to travel those long distances to have their clinic appointment. So fantastic. Along with the other the other 5 categories that we looked at, fantastic quality of posters.
So this is for patients with inherited bleeding disorders, such as haemophilia, von Willebrand's disease. And we're tertiary service, so we cover from Aberystwyth across and then into West Wales as well. So it's a long way for patients to come. So those with a milder form of the condition, we established a nurse-led telephone review clinic so that cuts out the need for coming to hospital for clinic appointments. The clinic is established, so they get a letter in advance to say this is your telephone review clinic, so they know the date and the time of the appointment. One gentleman I telephoned was a farmer up in mid-Wales. Was actually sitting on his tractor, so I phoned him at the appointed time and he said, "Oh, hang on, I'll just turn off my tractor." We went through the questions for the review, and I asked him afterwards, how was that? Would you rather come to the clinic next time? He said, "Oh, that was amazing, saved me so much time." And majority of patients are really positive with the experience.
I had an opportunity also to have my flu jab, so I would just encourage all staff to have their flu jab, and that looks after them as well as our patients.